Further comments are that disappointed in the developments at the Office of Inspector General. The objective in forming that was not only to provide the services of the Inspector General, but for that office to be able to distinguish between billing errors and criminal activity, and that criminal activity to refer to the Attorney General's office, and I don't think that's happening well. The objective in giving them independence from the Health and Human Services Commissioner was so that they could also analyze wrongdoing by agency employees as well. And I think now it's time to move them to supervision by HHSC.
I know you, Chairman Raymond.
Just a quick question. So on Inspector General, is it your testimony you think that the Executive Commissioner should appoint the Inspector General instead of the Governor?
Yes.
Okay, thanks.
And may I add a caveat to that? It's with great fear and trepidation that I say that, because there are arguments on both sides of that issue that are very valid. The independence that the OIG was given was on purpose, to keep there from being undue influence against against their investigation into agency staff and agency process and all that sort of thing. So, but I was very concerned about 775 employees at that OIG.
I think we heard from the staff that we're the only state where the governor appoints, and I said I don't have a problem with the governor appointing him myself, but apparently we're the only state, right?
Sure. I think that's what he said.
That we're the governor. So the other states are doing it the way Sunset is recommending
Yes.
it, and I guess it's working fine.
And so we do agree with Sunset on that. I guess my answer would be we tried it the other way, and so now let's put it under the Executive Commissioner's authority.
Thanks.
Senator Birdwell.
I'd like to follow up, if I may, Arlene. I didn't get to the OIG stuff yesterday because I had to depart early. Is this recommendation based upon the personality of the person currently there, and we're just trying to fix that personality by making a structural change?
It seems to me that the goals and the mission of the OIG's office have just grown and grown and grown, and that they need to be contracted dramatically. Right. So I think a better definition of what you expect of the OIG's office is necessary.
Would the rigor of this position, even if appointed by the commissioner, would you still recommend in some way it have Senate confirmation?
I have not considered that. That's
because this is
it's a big deal.
Big muscle movement.
It is.
And I think you can argue against the undue influence of the commissioner making that appointment if he still could. So I just,
yeah.
Again, I don't want to put too many ornaments on this Christmas tree, but I'm trying to make sure that we're addressing those concerns, but recognizing that I don't want to make structural changes because of a personality.
Right.
And that's what I'm trying to avoid.
And I agree, but as Representative Raymond said, other states have that position appointed by the commissioner type person, and it seems to be working well in other states.
Thank you, ma'am.
I have Senator Campbell and then Senator Hinojosa to follow.
Thank you, Mr. Chairman. It's nice to see you.
Thank you.
I wanted to ask more. So we see it, we've got 775 employees for the full-time employees at the Office of Inspector General, yet we're aware of how little, it seems, cases have been closed, open for a long time, and having follow-through, which is a little hard to understand with 775. Do you have a breakdown, or maybe their office does, I probably should ask them about, of that 775, how many are really, because it uses a lot of money, how many really are actively working on caseloads and getting, the turnover is so slow. Do you have an analysis of that many employees using that much money, but with such a poor product outcome in the way of just getting cases opened and closed, or defining a difference between criminal behavior versus administrative, discretions that need to be just taken care of.
We have not done that research, so
Okay.
your point's well taken, but I don't know.
Okay. Anything else you'd like to add? I know you had a limited amount of time, but I know you've done some work in this. Anything else you'd like to add to the Office of Inspector General comments, that office in general?
Only that the complaints that we were hearing prior to 2003 were that providers were being treated like criminals
Yes.
when they had made billing errors. And I don't know that that has changed, because the comments from the Sunset staff indicate that there's incentive to even shut down some providers. So however that office is restructured, I would like to see that be a goal again. I mean, we've got billing errors and we have criminal activity. Can't we do a better job of defining the difference and treating them that way? We have such a problem with getting people to participate in Medicaid that it needs to be as user-friendly as it can be for the good guys and as uncomfortable as it can be for the bad guys.
I think that's a good point, because only 3 out of 10 docs actually, or doctors are limiting their practice and not taking that much in Medicaid. I think only about 3 out of 10 doctors are actually taking on any new Medicaid patients. So if we could try to remedy that, it might provide more access for Medicaid recipients.
And I think several of the recommendations in the Sunset staff report point to that in streamlining accreditation and these kinds of things to make life easier for the providers.
Okay, thank you so much. Thank you, Mr. Chairman.
Thank you.